Welcome to Courtney on Health, brought to you on malcolmpresents.com. Anyway, have you stopped crying yet?
Ha ha. I told you not to bring it up.
I won't bring it up, but have you
I'm
stopped
not.
crying? Anyway, let's talk about, introduce our show.
He's talking about the New York Mets for those who are in other places in the world. Anyway, we won't discuss it. Go Yankees. Anyway, hi Courtney.
Go Brooklyn Dodgers.
Hi Malcolm. Hi and welcome to Courtney on Health, a Zoomcast
Hello.
pod. How are you doing?
I'm well. Good
Good,
to see you guys.
Good to see you. I saw you quickly this morning on a walking
That's
in
right.
opposite ways. My dog was doing twirlies, so she's
He was
yeah,
fun.
takes after me. No, anyway, this is Courtney on Health, a Zoomcast podcast series which focuses on one's overall well-being with tips on nutrition and exercise given by the infamous Courtney Gravenese, who is a registered dietitian with a Master of Science degree in nutrition and applied physiology. Courtney is an experienced nutritional and health consultant in the New York metro area, and we know it goes beyond to the asteroid that they asteroid that they darted out of the way of the planet. Interesting. And she will help you and guide you on a path to wellness and health. So
Hope so. You said infamous though, Maxine. Doesn't that
Yeah.
usually denote like negativity? I'm
no,
hoping
I won't
maybe
say
not quite
infamous.
famous, but
Okay, I'll say I'll say the famous Courtney on Health.
something like that. Go ahead. Sorry, I interrupted.
Infamous for her. No, anyway, at this point we can just I know that there's a song that I used to sing as a kid, and I know the man who wrote it, Ron Dente, and the lyric is sugar, honey, honey, you are my candy girl, and you got me wanting you. And that, again, that's a lyric from that song, Sugar, Sugar, by Ron Dante and the Archies. That was the group. And
Love that song.
my brothers as token boys and went on tour with Ron many years ago. He's a very nice guy. And so that brought into my mind that people love and crave sweets, ice cream, chocolate bars, gummy bears. They kind of help you, get through difficult times and happy times. You want to have something of a treat to get you through things. But what if you cannot eat sweets and your body cannot break down the food you eat? Our bodies turn food into energy, which turns into sugar, which is glucose, and releases it into our bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let blood sugar into your body cells for energy use. They use it as energy. According to the CDC, with diabetes, your body doesn't make enough insulin or can't use it as well as it should. Over time, that can cause health problems such as heart disease, vision loss, kidney disease. So today, you can tell the topic that Courtney's going to cover is the topic of diabetes and what to look out for and how to manage it via food and exercise. And she'll have some great information. So I guess let's start off with, there's diabetes 1 and 2. Can you give us an overview and define what those are and
Sure.
go from there?
Yeah, absolutely.
I have a question for you, Courtney.
Sure.
How come if all those sugars are bad for you, they taste so delicious?
But just to be clear, and we'll talk about this, it's not just like sweets and treats, and we'll talk about that in a second. So we'll talk about once you have diabetes, what you need to manage. But what we know about risk factors for type 1, type 2, and many of you have heard about pre-diabetes. So we'll talk about that as well. So let's first address type 1, because we're not going to spend a lot of time about that particular type of diabetes. Not that it's not important, it absolutely is, but it comprises a much smaller percentage of diabetes cases in the United States and worldwide than type 2, and now we're seeing with pre-diabetes. Type 1 diabetes is an autoimmune disease, and we hear a lot about autoimmune diseases, and it's essentially your body attacking itself because it's deeming the presence of something as an attacker. So it's an autoimmune disease. It's separate. It's typically diagnosed at a much younger age. So not always. You can be diagnosed with type 1 diabetes as an adult, but more often than not, diagnosed as a child. And again, more often than not, insulin is required. So insulin injections are required. Makes up a smaller percentage of that. Certainly need to watch carbohydrate, total carbohydrate. But type 2 diabetes and pre-diabetes are the two that have most commonly been associated with lifestyle factors. So we know that overall, there are about 37 plus million people in the United States who have some type of diabetes, and about 90 to 95% of those are type 2 diabetics, so people with type 2 diabetes. So your risk factors for that would be overweight and obese, and we're going to talk about that in a little bit. If you're 45 or older, but I will tell you that more and more children are being diagnosed with type 2 diabetes, and every year that number is continuing to grow. So although most of the cases of type 2 diabetes are seen in 45 and older, we're seeing younger and younger cases of it. Family history, so mom, dad, sister, brother. If you have a family member who's had diabetes, in all likelihood, you are going to be at risk as well. If you are physically active less than 3 times per week, which unfortunately is many folks, right, for a variety of different reasons, but that is a risk factor. If you have a history of gestational diabetes, I don't know if you guys have heard of that before, but that is the diabetes that is diagnosed during a woman's pregnancy. And hand in glove with that would be if you have given birth to a baby who is over 9 pounds. Now, that does not mean that if you've given birth, you will always become diabetic, type 2 diabetic, but it does put you at risk. We know in terms of races that African Americans, the Hispanic and Latino population, American Indian, Alaskan Natives, and Pacific Islanders all have a greater risk of developing type 2 diabetes at some point during their lifetime.
Is that a genes thing? I mean, how do you equate? How does that work? I mean,
so
that it hits races. I mean, what?
Yeah, they don't really know for sure. It might be part of it. Part of it might be the lifestyle factors associated with it. Oftentimes when you see about these increased incidences of disease among certain races, sometimes there's not always a hard rule about what's driving that. It could be that that there's, if you dig a little bit deeper, perhaps it's always more associated with somebody who might be, overweight, or the type of diet that they're following. So they really don't know for sure, but the bigger message is to make sure that we're really reaching everybody with the message about reducing your risk, but in particular, those populations of folks who fall into that category, to make sure that they know their numbers, getting treatment if necessary, and making sure that message gets out to them. We know that we're going to talk about pre-diabetes right now, but of course, as with many of the diseases we've spoken about on these segments, smoking. If you are a smoker, you are at 30 to 40% increased risk of developing type 2 diabetes. So it's really important. I get it. I know if you're a smoker, it's hard to quit. But out of all of these things that we're covering today, I would say let's put that one at the top, your hit list, top of the hit list.
The question is, how do we stop them from starting? Right. That's like,
yeah.
Well, I mean, and again, that's so many factors involved in that,
So many, and you would think that, the cost of cigarettes, and I don't want to digress too much here, would be a driver. It's crazy. I mean, it's a lot of money,
expensive.
But I get it. Yeah. It's addictive. Let's talk a little bit about pre-diabetes, because not that it's a great thing that we're picking up pre-diabetes, but I think if we can diagnose individuals earlier and intervene earlier and really encourage and educate and talk about those things that they can change, we have a better chance of preventing an individual with prediabetes from developing diabetes, type 2 diabetes later on. And that's important. So just like you said, Max, so if you think about that's a very common metaphor that's used to explain what insulin does in the body, that whole key and door relationship. So in some individuals, their pancreas is just not cranking out enough insulin to do the job, to move the sugar from the blood to working muscles, to cells, to your brain, which absolutely relies on glucose as food. So either not enough insulin being produced to meet that need, or there's a funky problem with that key and the door. So the key's not working. So the blood is stuck in the sugar is stuck in the blood, which is one of the reasons why the blood sugar is elevated. And the double negative of this is that insulin keeps getting pushed out. It's like, I don't understand. The insulin's still in the blood, the sugar's still in the blood, sugar's still in the blood, it's not moving anywhere. I'm going to keep pumping out, pancreas says, I'm going to keep pumping out more and more insulin, which creates an environment, and we've spoken about this before, of insulin resistance. So it just makes insulin, that key, less effective at opening that door. So it ends up being this cascade of problems over time if it's not treated early.
So how do you manage it? How do you, if you're pre-diabetes and you went to your doctor, I mean, as a dietitian, what would you need to cut? What would you need to keep? I mean, in there's foods that you eat that you don't even realize have sugar, as opposed to just the candy, gummy, sugary treats.
Yeah. So I think, again, I think just like many times we've spoken about this, you got to break down goals for people in small packages. I feel like smaller packages are much easier to move about than one large one. So we would probably tackle the first thing first, which would be probably total carbohydrate, talking about total carbohydrate intake. So the first ones to be, I don't want to say clipped out, because you want balance, but the first ones to target and to minimize would be those that provide very little nutritional value. So your sweets, your pastries, your cakes, your cookies, sodas, obviously that whole category of sweetened beverages, that would be the first one to try and minimize as much as possible. But even your healthier carbohydrates, so I have my bowl of apples here, things like pastas and rices, and even complex carbohydrates like rice and pasta eaten in excess are going to become a problem with somebody with diabetes, because the carbohydrate load is too great and is going to increase that blood sugar level, much higher than we would like. So it's all carbohydrates, but we want to encourage those carbohydrates that are whole in form, like we've spoken about, and that contain more fiber. Because fiber is, even though it's one of the carbohydrates, part of the carbohydrates, because it's indigestible, is not going to cause any spike in blood sugar. So a carbohydrate that has fiber in it is always going to be a better choice than something that then does not.
So if you ate wheat pasta, that would have less of a bearing on your intake of
100% whole wheat pasta certainly would be a better choice, but more often than not, when I'm working with somebody, we talk about not having an unopposed carbohydrate. And what I mean by that is, don't just have plain pasta, maybe with a red sauce. Better would be a pasta with a lot of vegetables. So you get that fiber in there from the vegetables, which creates an extra bumper, so you don't get that rise in blood sugar, or adding healthy fats, or adding a healthy protein option in there. So you're mixing the meal up. So it's just not the carbohydrate that's in your system, and it has less of a chance of having a spike in blood sugar level. So it's a little bit more about combining foods a little bit, which quite frankly is the way I encourage most of my clients to eat, for a variety of different reasons: satiety, blood sugar level, weight management. So it's not a necessarily difficult approach to follow for most individuals.
Right, that's good. So there's so much in this topic, but there's blood pressure and exercise. How does that work? And also body type. Also that is also something that is apparently giving you information.
Yeah. Well, if you don't mind, we'll take a step back a little bit, and let's just talk a little bit more about that pre-diabetes. So if you're listening or you're watching, I think it's important, just like with our blood pressure numbers, when we've spoken about know your numbers, you could be walking around with pre-diabetes or type 2 diabetes, and really your body is not going to throw up a flare. So much like with high blood pressure, it could be there for quite some time, causing damage and you not know. So it's important to see your healthcare provider and get a couple of tests. That's how prediabetes and type 2 diabetes are diagnosed. With prediabetes, actually in the case of type 2 diabetes as well, two of the more common tests, and you guys might have heard of this, it's something called an A1C, glycosylated hemoglobin. And if you think about that test, the good news is it does not have to be fast. You don't have to be fasting for it. So it makes it a kinder, gentler test for some patients to have. But it's more of a recording of what's going on in your blood, as opposed to a fasting blood glucose level, which is really a snapshot. So fasting blood glucose is a still photo. Your hemoglobin A1C is a rolling average of what's going on. So it ends up being much more predictive and accurate of how you've been over the last 3 months or so, 3 to 4 months. But oftentimes it's either one or the other or both of those tests that are used to diagnose either prediabetes or type 2 diabetes. So
Good to
knowing
know.
your numbers, what's that? Yeah,
That's good to know, to know your numbers. Yes, absolutely.
know your numbers. Yeah. So with hemoglobin A1C, a normal level is going to be lower than 5.7. Your healthcare provider will go through this with you. Somebody who's with pre-diabetes, that number will be between 5.7 and 6.4%. And type 2 diabetes, that diagnosis would normally be attached with an individual who's got an A1C of 6.5 or greater. So again, know those numbers. It's important. Sometimes your healthcare provider might say, you know what, let's come back in, let me do a recheck. Let's check this again, see what you can do with your diet, exercise. So let's see if we can get that number down in order to make an assessment of whether medication is needed. I think lifestyle change is always it's always the first try because many times with lifestyle change alone, we can get those numbers down. So blood pressure, a lot of times with somebody with type 2 diabetes, we do see cases of cardiovascular disease. We do see elevated blood pressure. So oftentimes it's not just one condition, it's multiple healthcare issues that a lot of these patients are seeing. So fortunately, many of the lifestyle changes that are needed to help bring down blood sugar level and to control some of that insulin resistance are the same lifestyle factors that are going to help with reducing blood pressure and reducing your cardiovascular risk. So that makes it a little bit easier.
Are there any symptoms that would indicate that you do have pre-diabetic condition or type 2? Is anything you should look out for in the way you feel or act that should alert you to go to your doctor?
One of the most common things to look for would be excessive thirst and urination. So that excessive thirst is very, very common. And obviously, some people do this at home, but you can actually do a urine stick test to see if there's any sugar in the urine. So one of the most common ones, again, would be that increased thirst and increased urination. Hopefully somebody is being tested periodically, particularly if they're at risk, some of those risk factors that we spoke about, so that those numbers are being monitored. I know in children now, so many, many years ago, they weren't testing kiddos under, who were 5 years old to 10 years old. It was not that common to have these tests done, but more often now they're testing younger kids to pick it up a little bit earlier, particularly if mom, dad, grandma, sister have had pre-diabetes or type 2 diabetes. So, and then you mentioned body type, Maxine, although we know that for cardiovascular disease as well, have you guys heard of the pear versus apple body type?
I've heard that thing. Yeah, I've heard about it.
Yeah. So I happen to have, my pear and my
pear and an apple. There you go.
So there it is, my pear and my apple, right on cue. Now, to be fair, many times a pear-shaped body is genetically driven. So you might not be able to do that much about the fact that that's just simply where you carry your weight. So apple versus pear, but the good news is if you are a pear shape, meaning you're carrying most of your weight around your hips and upper thighs, as opposed to an apple shape, which will center it around your trunk and your vital organs, that puts you at greater risk for not only cardiovascular disease, but type 2 diabetes as well. Why? Well, one of the theories is that if you think about that excess adipose, that excess fat that's putting a lot of stress around your vital organs, that in turn is going to relate to health issues. So again, it's just, mentioning about the different body types. And we know that overall weight, that was at the top of the list. So overweight and obese individuals are going to be at greater risk for type 2 diabetes. Now, this is not, I know I'm going to get into a little bit of trouble for this. When we hear about healthy at any size, I believe everybody should be treated with respect, regardless of how large they are, what they look like. They should always be treated with respect, certainly by your healthcare provider and your healthcare team. But I do wonder if that message would be a better message if we said, listen, we don't expect anybody to be skinny, you don't need to be skinny mini, but you do need to know that simply losing 5 to 10% of your body weight, I shouldn't say simply, because even that can be difficult for individuals, but losing 5 to 10% of your body weight is going to, in all likelihood, bring those sugar levels down, give you a little bit more control of your insulin levels, bring down your blood pressure. So yes, respect at any health weight, at any weight, but I think we really need to get out the message that let's help folks get that 5 to 10% off to at least try to control one of those risk factors, and let's work with them to help them try to meet that goal.
So what about in that light, the National Diabetes Prevention Program? Is that something people can find out about, and if they need to get help through that program, is it available?
Absolutely. I would encourage anybody who's got, access, just type in, National Diabetes Program. It'll probably drive you to the CDC, component, the website there. There are nationally locations that are sponsoring this program. There is certain criteria, some of which is that you need to be overweight or obese to begin with. You can't already have type 2 diabetes. But if you are at risk for it and don't have it, you can be enrolled in this program, and it is meant to help you with healthy eating habits, really focusing on lifestyle management. So it'll helping quit smoking, helping encouraging a way to be more active. Like, instead of just saying, exercise more, really working with you to say, what, we're gonna, every day you try and go out and do something for 20 minutes every single day, to making it a little bit more manageable. So I would strongly encourage you to look into it if that's something that, again, you're falling into that category of high risk, and see if there's a location near you. I do know that they're offering not only in person, but they're offering virtual enrollment as well, which I think for a lot of people knocks down a lot of barriers to getting there. Because if you're working and you got kids and you're the last, humans, it's like we're always going to put ourselves last, right? So if there's a virtual option, that might allow an opportunity for more education without having to physically go into a hospital or clinic setting.
Yeah, Courtney, I can understand why, weight or food might be a factor in pre-diabetic or diabetes too. But how does smoking fit in? Because the only thing I know with smoking is involved with the lungs. But how does that affect the production of insulin?
If you think about sort of your whole bodily functions of like everything that goes on, your vessels, moving, blood from, through your cells, through your, organs, blood through your vessels. Smoking creates an environment in your vessels, that's inflammatory. So it creates an environment of increased inflammation, which we mentioned before about insulin. And we know that a heightened state of inflammation creates an environment of insulin resistance. So that's number one. There's that excess rate of inflammation, and then the inside of your arteries, your blood should be nice, thin for the most part, not too thin, but not gunky like used motor oil. And what we know, unfortunately, with smokers who've been smoking a long time is that rather than having a nice, thin, easily moving blood throughout your vessels in your body, it becomes clogged and gunky and has a greater chance of getting stuck on the inside of your arteries, again, creating another state of inflammation. So it all kind of ties in with not just raising your blood sugar level, but how your insulin is working and if it's working as it should.
Mm.
It's
So many
interesting because
factors.
I've never really heard anything on TV or the shows about that, how the smoking, clogs up all the, your blood vessels. You always hear about, of course, the heart and the breathing, but not what you said,
It's all
like
connected, so
oil.
how could it not be?
Yeah,
but
it's all plumbing, man. It's plumbing and electricity. That's
Exactly. I mean, one's gonna, definitely hit the other because of the connectivity of it, and so it doesn't surprise me that smoking can cause this issue as well. Because look what you're breathing in. I mean, and I guess air pollution to an extreme does that as well. I mean, the pollutants could harm you in a lot of ways. I'm not sure if it's in a way to cause the insulin to have a different,
right.
but there's so many things now that you have to
Right.
deal with. It's environmentally that, you don't know anymore. It's like, but
Yeah.
has there been an increase in diabetes?
Absolutely. And
over
like
the
I said,
years?
the numbers have grown, particularly among children. So where type 2, remember we said at the top of our time together, type 1 is usually diagnosed in childhood. And, I would say, 20, 30 years ago, maybe, again, if we're not looking for it, maybe these kids are walking around with type 2 diabetes and we're just not detecting it. But now we're seeing more and more cases of it. And I will say, that's completely unrelated to smoking. That's almost always related to inactivity. And then that inactivity in conjunction with, overconsumption of not so healthy foods of all types, not
Right.
just sugary foods, is leading to overweight and obesity at a very young age. So it's really important to get these kiddos. I would say the one thing, if you've got a child who's been diagnosed with prediabetes, or you are worried about them because you have diabetes, is to, as much as, like I said, break it into little packages. So that package might be 15 to 20 minutes of some type of activity, whether it be in your home or outside your home, to try and move a little bit more, is one of the best first steps to try and get that under control.
Right. So getting the kiddos into a sporting activity is a good idea. Always
You're getting them off their computer and their
getting
cell
them
phone.
out of, we take this away for a little bit
Yes.
and give them a soccer ball, so, or something that they would like. I know, luckily my son, he loved sports, and so he was on the baseball and soccer
Yeah.
things. And I know your son is also, he likes to play.
Yeah, I mean, my sons, if they weren't playing the Little League, they were doing the American Youth Soccer Organization or playing
Right.
tennis.
Yeah, same thing here, because you have to
Yeah.
try to set an example and just throw them out there. Get out and play.
And it should be so, but like, it seems like all of our kids fall into those buckets of kids who participated in some kind of sport. But to make this a little bit easier for everybody, I would say, if let's say you got an artsy kid, right, who really cares nothing about sports at all, not one iota. Well, that kid still needs to be active. So maybe that activity might be, just walking or going for a hike or hopping on a bicycle. It doesn't have to be an organized sport.
Right.
It just has to be something. We want to make sure that we're covering all kiddos and not just the kids who are participating in organized, structured sports.
Right. Going out for a walk.
Anyway, guys, I hate to say this, but we've reached the end of our time.
We've reached it. See, it
Oh,
goes
boy.
fast.
Oh boy. So there'll be more information about this on Courtney's various websites.
This is
and various-
a very important thing, both for us seniors and for those who have the kids.
Right.
To watch out and get them involved with.
Right. I mean, I like the song Sugar, Sugar, Honey, Honey, but you gotta
Love
watch
that.
it.
Do love that song. I do.
I got to admit that Ron was one of the nice. He's such a gentleman, just a good guy. And my brothers knew him. You know, he knew my brothers for a real long
Well,
time.
as I said at the beginning of the show, the problem is these foods are taste so good, especially the sugary foods, like
Yeah.
you know, the ice creams and the chocolates and it's pushed so much. I mean, you go in the cereal, we always talk about this in the cereal aisle, and
Right.
everything is sugar coated.
Hmm. Well, you
But
have to
anyway,
be an educated consumer and make sure you try to eat well. And sweet now and then is okay, but you gotta watch it. You know, you gotta watch it. So thank you.
take us out, Max.
Thanks for joining us for Courtney on Health. To get more info, follow Courtney on her Facebook page, which is Courtney on Health, on Instagram at CLG Wellness, and on TikTok. Woo! Visit her website, CourtneyGravanese.com. For more shows, go to MalcolmPresents.com and theManyShadesOfGreen.com. This has been Courtney on Health, Smart Sound Nutrition, Strong, Safe Fitness, and we will catch you again next time.
Thank you,
Catch you next
Courtney.
time.
And
Have a great week.
by the way, as we started out at the beginning when we're talking to you, you do telephone consulting.
Yes,
Right.
absolutely.
And I've been recommending, because as I say, I've been speaking to my friends and I've been recommending that they call you or contact you or go to Courtney on Health. And because you're only a phone call away and you're only a Zoom call away. So no
That's
matter
right.
where you live, you can contact Courtney and you can contact her on a Zoom or just on a regular phone call.
Absolutely. Happy to.
Absolutely. I've been saying this
and
for
she's
over a year
great.
now that I need Courtney's services.
I'm coming after you, Max. I'm gonna walk up
Yeah,
the street.
yeah. I'm gonna, I don't know. You know, I'm trying to get people around me to eat better. I mean, I eat pretty, I think, okay, but you'll probably hit me a few times. I don't know.
Guys, we'll see you next week. Thanks
Take
again.
care.
Bye.
Bye, guys.
Bye, guys.